Acanya Gel is a topical medication used for the treatment of acne. It is a combination product containing two active substances, clindamycin phosphate and benzoyl peroxide. Clindamycin is an antibiotic that helps to reduce the growth of bacteria on the skin, while benzoyl peroxide helps to unclog pores and reduce inflammation. Indications: Acanya Gel is prescribed for the treatment of acne vulgaris, a common skin condition characterized by the presence of pimples, whiteheads, blackheads, and inflamed lesions on the skin. How to use: wash your hands in the affected area before applying the Acanya Gel. Gently clean and pat dry the skin area where you will apply the gel. Apply a thin layer of the gel to the affected area once daily, preferably in the evening. Avoid getting the gel in your eyes, mouth, nose, or other sensitive areas. If contact occurs, rinse thoroughly with water. Do not apply more than the recommended amount, as using more will not improve the results and may increase the risk of irritation. Contraindications: don't use Acanya Gel if you are allergic to clindamycin, benzoyl peroxide, or any of the other ingredients in the gel. You have a history of severe allergic reactions to other antibiotics. You have a history of inflammatory bowel disease such as Crohn's disease or ulcerative colitis, or a history of antibiotic-associated colitis. Precautions: avoid excessive exposure to sunlight or artificial UV rays such as tan beds while using Acanya Gel, as it can increase your skin sensitive to sunlight. Use sunscreen and wear protective clothing when outdoors. If you experience excessive dryness, redness, peeling, or irritation of the skin, reduce the frequency of application or consult a healthcare provider. Don't use Acanya Gel on damaged, broken, or sunburned skin. Inform your healthcare provider about all other topical products, cleansers, and medications you are using to prevent potential interactions. Side effects: common side effects of Acanya Gel may include, but are not limited to, dryness, peeling, or flaking of the skin, redness, irritation at the application site, burning or stinging sensation. Less common but potentially serious side effects may include severe allergic reactions, rash, itching, swelling, severe dizziness, difficulty breathing, diarrhea or abdominal pain, indicating possible antibiotic-associated colitis. If you experience any severe or unusual side effects, discontinue and seek medical attention.